Can you get pregnant after uterine fibroid treatment? Can you really get pregnant after having treatment for uterine fibroids? The answer is yes, but it depends on several factors. These include the type of treatment you receive, the size and location of the fibroids, your age, and your overall reproductive health. Uterine fibroids are non-cancerous tumors that can sometimes interfere with fertility. They may affect how sperm moves, how an embryo implants, or the overall environment of the uterus. Treating fibroids can often improve your chances of getting pregnant, especially if you have experienced infertility or other symptoms related to them. Let's look at two common treatments that can impact fertility: uterine fibroid embolization and myomectomy. Uterine fibroid embolization, or UFE, is a minimally invasive procedure. It works by blocking blood flow to the fibroids, causing them to shrink. Research indicates that around 38 to 40% of women become pregnant after UFE. Some even have multiple pregnancies and live births within 2 years following the procedure. Interestingly, fertility rates after UFE can be similar to those after myomectomy in certain studies. However, it is important to note that UFE does come with some risks. These include potential ovarian impairment, especially in women over the age of 40, as well as increased risks of placental issues, pregnancy loss, and preterm delivery. Because of these risks, it is crucial to have careful counseling and a personalized assessment before choosing UFE if you are hoping to become pregnant. Despite these concerns, many pregnancies after UFE can still go on to term successfully. Now, let's talk about myomectomy, which is the surgical removal of fibroids. This procedure is often the preferred choice for women who want to maintain or improve their fertility. A large study found that there is no significant difference in pregnancy or live birth rates based on the type of surgery performed, whether laparoscopic, hysteroscopic, or abdominal. Myomectomy can create a more favorable environment in the uterus and reduce complications associated with fibroids. Recovery time and risks can vary depending on the type of surgery and how many fibroids are removed. It's also worth mentioning that some women with untreated fibroids can still conceive and have healthy pregnancies. However, fibroids may increase the risks of miscarriage, preterm labor, and complications during delivery. Therefore, treatment decisions should take into account the severity of symptoms, the characteristics of the fibroids, and your fertility goals. From a fertility and endometriosis perspective, it is essential to recognize that fibroids and endometriosis can coexist. Both conditions can affect fertility. Effectively managing fibroids may improve your overall fertility outcomes, but a comprehensive evaluation is necessary to address all factors impacting reproductive health. In summary, getting pregnant after uterine fibroid treatment is possible. Myomectomy is often the best option for women focused on fertility, while UFE can be considered but with caution due to its associated risks. It is always best to seek personalized medical advice from a fertility specialist to determine the most suitable treatment approach for your individual situation.